What is periodontitis and how to treat it? Periodontitis is a serious gum infection that damages the soft tissue and destroys the bone that supports your teeth. Periodontitis can cause teeth to loosen or lead to tooth loss. Periodontitis is common but largely preventable. It's usually the result of poor oral hygiene. Brushing at least twice a day, flossing daily and getting regular dental checkups can greatly improve your chances of successful treatment and can also reduce your chance of developing the infection. The name periodontitis means inflammation around the tooth. Bacteria stick to the surface of the tooth and in the pockets surrounding the tooth. As the immune system reacts and toxins are released, inflammation occurs. If left untreated, periodontitis will eventually result in tooth loss. It can also have other implications such as, may increase the risk of stroke, heart attack, and cause other health problems. Bacterial plaque will develop over the surface of teeth, and is the most common cause of periodontal disease. If the plaque is not removed, it can harden to form tartar. Follow your dentist's recommended schedule for regular checkups. If you notice any symptoms of periodontitis, make an appointment with your dentist as soon as possible. Periodontitis versus gingivitis. Gingivitis occurs before periodontitis. It usually refers to gum inflammation, while periodontitis refers to gum disease and the destruction of tissue, bone, or both. Untreated gingivitis can progress to periodontitis. There are several different types of periodontitis. 1. Chronic periodontitis, which is the most common type, affecting mostly adults. This type is caused by plaque buildup and involves slow deterioration that may get worse over time, causing destruction in the gums and bone and loss of teeth if not treated. 2. Aggressive periodontitis, usually begins in childhood or early adulthood and affects only a small number of people. It tends to be hereditary, affecting families and causing rapid progression of bone and tooth loss if untreated. 3. Necrotizing periodontal disease. This is characterized by the death of gum tissue, tooth ligaments and supporting bone caused by lack of blood supply, resulting in severe infection. This type generally occurs in people with a suppressed immune system and malnutrition. Symptoms. Healthy gums are firm and pale pink and fit snugly around teeth. Symptoms of periodontitis can include, 1. Inflamed, swollen or puffy gums and recurrent swelling in the gums. 2. Bright red, dusky red or purplish gums. 3. Gums that feel tender when touched. 4. Bleeding when brushing teeth or flossing. 5. Gums that pull away from your teeth, recede, making your teeth look longer than normal. 6. New spaces developing between your teeth. 7. Pus between your teeth and gums. 8. Bad breath. 9. Loose teeth. 10. A metallic taste in the mouth. 11. Painful chewing. 12. A change in the way your teeth fit together when you bite. Treatment. The main aim of treatment is to clean out bacteria from the pockets around the teeth and prevent further destruction of bone and tissue. Oral hygiene. Good oral hygiene should be followed daily, even if the teeth and gums are healthy, to prevent infection. Proper dental care involves brushing teeth at least twice a day and flossing once a day. If there is enough space between the teeth, an interdental brush is recommended. Scaling and cleaning. It is important to remove plaque and calculus to restore periodontal health. A healthcare professional will carry out scaling and debridement to clean below the gum line. This may be done using hand tools or an ultrasonic device that breaks up the plaque and calculus. This may take a number of visits. Cleaning is normally recommended twice a year. Medications. Prescription antimicrobial mouth rinse. A mouthwash such as chlorhexidine may be prescribed to control bacteria when treating gum disease and after surgery. Use it as you would a regular mouthwash. Antiseptic chip. A small piece of gelatine that is filled with chlorhexidine. The chip controls bacteria and reduces periodontal pocket size. It is placed in the pockets after root planing. The medication is slowly resealed over time. Antibiotic gel. Antibiotic gel contains an antibiotic called doxycycline. It helps control bacteria and shrink periodontal pockets. It is a slow-release medication and is placed in the pockets after scaling and root planing. Antibiotic microspheres. Very small particles containing minocycline, another antibiotic, are placed into pockets after scaling and root planing. Enzyme suppressant. This will keep destructive enzymes in check with a low dose of doxycycline. Some enzymes can break down gum tissue, but this medication can delay the body's enzyme response. It is taken orally, as a pill. Oral antibiotics. Oral antibiotics are used short-term for the treatment of acute or locally persistent periodontal infection and are available in capsule or tablet form, taken orally. Advanced periodontitis. Surgical intervention may be needed if non-surgical treatments are not effective. These options include the following. Flap surgery. Flap surgery is performed to remove calculus in deep pockets, or to reduce the pocket so that keeping it clean is easier. The gums are lifted back, and the tartar is removed. The gums are then sutured back into place. Bone and tissue grafts. New natural or synthetic bone is placed where the bone was lost, promoting new bone growth. Guided tissue regeneration (GTR) is a surgical procedure that uses barrier membranes to direct growth of new bone and gum tissue at sites where one or both of these are lacking. Its aim is to regenerate tissue and repair defects that have resulted from periodontitis. In this procedure, a small piece of mesh-like material is inserted between the gum tissue and bone. Home remedies. The effects of periodontitis can be stopped through regular checkups and treatment and continued good oral hygiene. 1. Brush after each time you eat or have a sweetened drink. 2. Use floss every day to clean between the teeth, in the spaces that the brush cannot reach. 3. Take extra care when cleaning around uneven surfaces. 4. After brushing, use an antibacterial mouthwash to help prevent bacteria from growing and to reduce any inflammatory reaction in the mouth. 5. Brush your tongue from back to front. 6. Brush the teeth for 2 minutes, twice a day with either a manual or electric toothbrush that has soft bristles, carefully cleaning the chewing surfaces and the sides of the teeth. 7. Use a fluoride toothpaste. 8. Or consider a probiotic toothpaste, as some early research suggests probiotic mouth products may also fight plaque effectively. 9. Rinse the brush well after use and store upright. 10. Replace the toothbrush every 3 to 4 months, more if the bristles are matted or frayed. 11. Never share brushes, as bacteria can pass from person to person in this way. 12. Use a natural gum rub or gel like the following. Clove rub, turmeric gel, aloe vera gel or juice rinse, neem gel or black cumin gel. Risk factors. The following risk factors have been linked to a higher risk of periodontitis. Smoking. Regular smokers are more likely to develop gum problems. 90% of cases that do not respond to treatment are smokers. Hormonal changes in females. Hormonal changes occur during puberty, pregnancy, and menopause. These changes increase the risk of developing gum disease. Diabetes. Diabetics have a higher incidence of gum disease than other individuals of the same age. AIDS. Gum disease is more common in people with AIDS. Cancer. Cancer treatments can increase the chance of gum disease. Drugs. Medications such as antihypertensive drugs, vasodilating agents, immunotherapy drugs, and medications that reduce saliva can all increase the chance of gum disease. Genetic factors. Some people are more susceptible to gum disease due to genetic factors. Diagnosis. A dentist can normally diagnose periodontitis by looking at the signs and symptoms and carrying out a physical examination. The dentist will probably insert a periodontal probe next to the tooth, under the gum line. An X-ray may also help assess the condition of the jawbone and teeth. 6 supplements to help you remineralize your teeth. Remineralization is a very effective process that your body naturally undertakes in order to keep your teeth healthy and strong. And just like any other process in your body, it needs the right nutrition to run smoothly. Try the following supplements along with a normal healthy diet: calcium, vitamin D3, vitamin K2, magnesium, collagen, oral probiotics. If you enjoyed this video, please click the like button. We need your support to keep posting, so please subscribe and click that bell notification button so that you get notified when I post new videos. And if you would like, leave a comment below. Thanks for watching and I will see you in the next video.